in other world news, the French government has said that it hopes a COVID vaccine will be approved and available as early as the beginning of next year. However, the government is worried that millions of French people may refuse coronavirus shots because they believe the vaccine isn't safe. Now, the latest vaccine by the US company Moderna has been found to be around 95% effective. The government, though, is still trying to roll out a national awareness campaign to explain why the vaccine is safe. Here's France's health minister. Take a listen.
Donc, ce que je veux vous dire, c'est que j'ai besoin de savoir.
I need to know that the vaccine is effective and safe. If it is, and we have the proper authorizations, we will work double time. The logistics are monstrous to have vaccinations ready at the start of next year.
Au début de l'année 2021.
Well, listening to the health minister there was our international affairs commentator, Douglas Herbert. He joins me now. Douglas, first of all, tell us, why is there so much skepticism here in France about the safety of a vaccine?
Well, first of all, it's not just France. This is a phenomenon throughout many countries in Europe and the United States and elsewhere. A lot of it is linked to just distrust in government, a lack of trust in what the government tells them about these scientific advances. And also, especially in the case of the United States under the outgoing Trump administration, a growing mistrust of science and scientists, vaccine skepticism. You know, a few months back, there was a group of scientists in the United States who issued a report basically saying that there's this assumption among a lot of people that, quote, if you build it, they will come. Meaning if you roll out a vaccine, people will come and get the shot because they don't want to get COVID. It will be welcomed across the world. It turns out that that's in many cases, if not a totally false assumption, it is overstated because if you're talking about France, Germany, UK, Italy, United States, a minority of people in all of those countries say that they will definitely want to get a vaccine when and if it's rolled out. And that is quite a stunning revelation because a lot of the fight against COVID is under the assumption that the vaccine is the light at the end of the tunnel. Once you have that vaccine, you have a way of finally putting an end to this virus. If you don't have that, and in addition to that, you have in a lot of places mistrust about basic sanitary gestures, using gels, wearing a mask, keeping socially distanced. It's a double whammy, not wanting to take a vaccine and yet at the same time shunning the basic social distancing and other sanitary measures. So how do you fight COVID? So there are a lot of assumptions that people are making that perhaps they shouldn't be making. This distrust should have been tackled a lot earlier. Governments are belatedly realizing that they're going to have to put a lot of money, if not as much as they put into developing the vaccine, a lot of money into public awareness and information campaigns to try to lower this bar of skepticism.
Despite that skepticism that you say is very prevalent, Doug, it's clear, though, that for many people, the news in the last week or so that 2 vaccines are close to being ready has been a real sigh of relief for so many people. That said, though, clearly there are real obstacles ahead. Talk us through what's to come in the next year.
Oh, look, there are any number of known unknowns. I don't want to be the spoiler here. It is great news that these vaccines are on the way. Their efficacy, 90% to 95% for the Pfizer and Moderna vaccines. That is way above what a lot of scientists had hoped for, even way above what the U.S. authorities require in terms of efficacy. They only require about 50%. But look, we know about the shipping requirements, especially for the Pfizer vaccine, minus 70 degrees Celsius. Those conditions are very hard to simulate, especially in poorer income countries that don't have necessarily the shipping facilities. Also, the questions of these are so far vaccines, the ones that we've heard about that require 2 jabs a few weeks apart. The ideal vaccine, the elixir, would be 1 jab. It's hard to get the same people to come back 3 weeks later and to ensure that they get that second vaccine. Then you also have the question of the elderly. The elderly are a group that are seen as most at risk, the over 65s. It's not clear that every vaccine will be right for them. There might be some vaccines still in the pipeline, even that we don't know about, that are better suited for older people. And finally, there's the question of long-term efficacy. You don't want to have a vaccine, or at least it wouldn't be very effective, if every 2 or 3 months you have to go back and get another jab or 2 every few weeks. Pfizer says that it's pinning its hopes on its efficacy being about a year, which is perhaps the minimum standard for a vaccine, having to go and get an immune booster every year. Finally, I'll say that there's the issue of sterilizing immunity. Is this a vaccine, Nadia, that is just going to help you not get COVID, or is it also going to sterilize you in an immune way? That means ensure that while you don't get COVID, you also don't have the potential, even if you get it and you're not affected by it, of spreading it to someone else. So does it stop the disease, or does it stop does it also make you immune and ensure that you're not able to infect others? Very big questions, no real answers yet, and only further trials are going to show that. We won't have answers until a lot of it's already on the market, perhaps for emergency use approval, which is expected in the US in the first half of December, and perhaps in Europe in early January.
All right, Doug, thank you very much indeed. And it is worth saying that we'll be talking much more about the vaccine and the politics surrounding vaccinations in the France 24 debate. That's coming up a little bit later on this